Hello everyone, and welcome to this webinar of CELLBOOSTER. And today we are going to talk about CELLBOOSTER and the reveal of CELLBOOSTER LIFT Clinical Study. We're going to explain the protocol and the results. While we give a little bit time to the people to connect, I would like to introduce myself. I'm Dr. Gabriel Siquier. I'm the founder and medical director of 𝗃𝗏𝗏𝗏 Clinics International. We have clinics in the Netherlands and in Spain. I'm a part of the research group 𝗑𝗏𝗏𝗵 at the University of Girona in Spain, and it's where we developed this study that I'm going to present today. And I'm a board-certified aesthetic physician in Spain by the Official Medical College of Doctors, and in the Netherlands as well by the Royal Society of Medical Specialists. So let's gonna see and to understand deeply how we improving the cell metabolism, we will be able also to improve the skin health and quality, and which ones are going to be the results that we are going to have injecting this wonderful product that is CELLBOOSTER LIFT. But first we need to get a little bit situation where we are. And when we are looking for the perfect look, can be an interplay between proportion and quality. But we are thinking, okay, is beauty related to proportions? And yes, then we are always looking for symmetry, for balance between the 3/3 of the face. Now we are taking more measurements, like could be like the golden ratio. And maybe soon we are going to have artificial intelligence that can measure parameters and can guide us to make our patients to obtain a better treatment. But the perfect proportions are not the only thing that we need to take into consideration when we are doing an aesthetic treatment, because the quality of the skin is also very important. The skin not only reflects the age of the person, but also how the person feel, if it's healthy or unhealthy, and sometimes also the energy that we can see. So we need to have this balance between proportions in our face, good volume, but also a good skin quality to have a better skin rejuvenation. It's important when we are talking about skin rejuvenation is to try to stimulate the metabolism, because we see when we are babies, when we are just born, we have high levels of high molecular weight hyaluronic acid, we have a longer chain of 𝗃𝗏𝗏𝗏, and as well as we are aging, this chain is going to get reduced, and is also going to reduce the concentration. High levels of high molecular weight hyaluronic acid will stimulate also collagen and collagen production, and is the main component of the extracellular matrix. So when we have high concentration of 𝗃𝗏𝗏𝗏, we are going to have a high cell metabolism. So we're going to produce elastin, collagen, and also hyaluronic acid. High molecular weight 𝗃𝗏𝗏𝗏 has antioxidant activity. And in the CELLBOOSTER, we also have vitamins that will complement the activity of the cell, that will fight against the reactive oxygen species. That is the thing that make us really age, the UV radiation, pollutants, but also cellular stress and chemical stress. So we can see that when the balance is getting from the other side, we will reduce the levels of hyaluronic acid and will also shorten the molecule and as other glycosaminoglycans, that they are very important for the interaction in the extracellular matrix structure, and we will have faster destruction of collagen and elastin, but also less production. So we are going to have a cell depletion, we are going to have an altered metabolism, we are going to have an empty dermis. So the skin is going to become a little bit dry, it's going to become thinner, and because of this depletion, we are going to have more wrinkles on the skin, and also we are going to have the depletion of volume in other tissues like subcutaneous tissue or bone resorption. Cell Booster Lift has specific indications for moderate skin depression, loss of firmness, laxity of the skins for the facial tissue and contours. We can also use it on the bodies. Has a specific indication for fine lines and wrinkles. Thanks to the hyaluronic acid that we have on the formulation, will work very good for dehydrated skin and loss of skin tone and microcirculation. And we can also regenerate the skin when we are having some types of scar, like the acne scars or striae. And will also has a positive activity on the cuprosis. The injection plane will be on the superficial or medium dermis, on the face, neck, décolleté. We can also use it for the back of the hands, the internal face of the arms, or all the body. The composition is coming in a vial of 3 milliliters of hyaluronic acid, 80 milligrams. And then we have a specific cocktail of vitamins, that is riboflavin, the B2, vitamin C, that you know that has anti-pigmentation activity, the tocopherol, vitamin E, that is very good when we are having a plus 35 years skin, because it's going to help to regenerate better the skin, biotin, and a cocktail of amino acids. In this case, is arginine, glycine, lysine, proline, and valine. All of that has been developed with the CHAC technology. As you can see, we have a very complex composition. This is going to lift and smooth the wrinkles, will help on skin redensification, and will also improve the skin tone and the microcirculation. So we are going to have a more healthy cells. So we are going to have a better skin quality. The patented CHAC technology modifies and exploits natural properties of the hyaluronic acid in order to link the amino acids and the vitamins that they are into the formulation without the use of any binding agents. So that makes this technology unique. This hyaluronic acid, vitamins, and amino acid stabilized complex will become an optical vehicle for transporting these essential nutrients into the cell and to have a good diffusion into the skin. Let's gonna see the major steps that we can find thanks to this CHAC technology for the creation of the cell booster complex. First of all, step one, we are going to create a matrix of hyaluronic acid. Is a network made of high molecular weight, HA, of 3 million Daltons, plus the vitamins, hydrophilic or hydrophobic, the amino acids and the peptides, and the oligoelements. Depending on the formula, we will add one specifics or the other ones. This is the CHAC technology to produce all the cell booster products. Then we are going to do a shear deformation plus a resting time. And in this second step, we're going to have a mechanical mixture. So there are going to be some links created in between the hyaluronic acid and the components that we put into the formulation. And it's going to create a specific weak bonds. These weak bonds are hydrogen and van der Waals interaction, among the hyaluronic acid and the added nutrients. So we're going to have the integration of the active components into the hyaluronic acid chains, creation, this interaction that will create a complex stabilization, but also this complex is going to be able to protect the vitamins and the amino acids that will be fastly degraded. Then we are going to form the 3D high molecular weight hyaluronic acid macromolecular structure with the integrated amino acids and vitamins, and then we are going to go to the liquid phase. We're going to put water as a buffer, and we're going to have the rehydration of this 3D stabilized complex. So that will give even more stabilization, that will protect the hyaluronic acid molecules without any physical binding between the hyaluronic acids, the vitamins, and the oligo elements. If we are trying to imagine this, I want to make a comparison with something that is very evident to all of us. So if we look into our solar system, there are non-physical interactions between the Earth and the Moon, or between the Sun and the Earth. So we don't have a physical bridge between them, but they attract to each other, and thanks to these interactions, we are together in the solar system. So the CHAC technology is something similar, so that we don't have a covalent bridge between the molecules and the hyaluronic acid, but they are linked together thanks to these interactions between the hydrogen bonds and the van der Waals links. Hyaluronic acid high molecular weight, remember, 3 million Dalton, will have intrinsic structural and biological benefits for the aging skin. The supramolecular complex is formed in a solid phase that will give a uniform distribution of the amino acids within the complex. Then we're going to have a good integration between both the hydrophilic and the hydrophobic components, the vitamins, for instance, and we're not going to have any excess of added ingredients. So we're going to have adequate dosage for a better integration onto the skin. Then, thanks to the supramolecular complex formed in the liquid phase, we are going to have a slow, gradual, and optimal release of the active ingredients into the skin. So we are gonna have this big structure that slowly will degrade and integrate properly in the skin, and is gonna have this activity of biorestructuration thanks to the hyaluronic acid, and biocomplementation thanks to the vitamins and amino acids that we have into the formula. Which one are the advantages of CELLBOOSTER? We don't have any chemical binding agent, we don't have any BDD, we don't have any glycerol, any pectin. That is only through mechanical activity. It's through shear deformation and simultaneous pressure. So we don't have risk of vascular compromise, that thing that could happen with dermal fillers. So we have better safety, and we're gonna have less risk of adverse events. The gradual and optimal release of the active ingredients is not a simple blend of random active ingredients. They are specifically formulated for the indication for that we are looking for. So we are going to deliver the active ingredients slowly and efficiently into the skin. So that implies a better bioavailability. Day after day, we are going to have more benefits, and we are going to achieve long-lasting results thanks to the cumulative effects that this formulation have. And the unique complex of ingredients and product treatment combination, we can cover multiple indications, and we can also combine with several products in the same treatment protocol, like would be hyaluronic acid fillers or botulinum toxin. We will have a little explanation at the end of the webinar today. Just before I continue, I would like to remember you that you can make all the questions and answers that you want during the presentation on the question and answer chat, and I will answer them at the end. So if we are looking to the products that we have into the Cell Booster portfolio, we have Cell Booster Lift that I'm presenting the study today, Cell Booster Glow that is more indicated to reduce hypopigmentation and for a younger demographic. Cell Booster Shape is indicated to reduce localized fat and liquid retention, so it's a very good lymphatic drainage product. And Cell Booster Hair that will nourish the scalp and will stimulate the hair growth and reduce the graying of the hair. So it's very good for patients with non-cicatricial alopecia. So we have a very nice portfolio with Cell Booster with different indications. What kind of products are Cell Booster? Well, it's a medical device class 3, CE mark, so that means two things, that is safe and is effective, but also can be injected, has passed all the requirements and all the certifications, so it's a product that we can inject without any problem into the skin. We are having an injectable stabilized booster of hyaluronic acid, amino acids, vitamins, and oligoelements, and the Cell Booster range has born from the patented CHAC technology from CELL, this wonderful method of mechanical stabilization without any vindication through shear deformation and simultaneous pressure. Cell Booster Lift is a specific product for skin rejuvenation for a little bit older demographic. We have a specific components, the vitamin B2, C, E, and B7. They are essential for the extracellular matrix, essential for the cell metabolism. And then we have these amino acids, arginine, that is antioxidant and is going to give us hydration. The glycine and the proline, they are part of the collagen, so will help to build collagen in our skin. The lysine and the valine, they are essential amino acids, or they are only provided by food, so will also help to improve the quality of the skin. This hyaluronic acid Cell Booster Lift is injected into the dermis, medium dermis or deep dermis, and will have a diffusion into the skin. It's going to have hydration and better extracellular matrix structure thanks to the integrity, and that's going to be healthy for the skin. And then we are going to stimulate keratinocytes and fibroblasts. We are going to have a higher cell metabolism. We are going to renew the communication between the cells. So we are going to stimulate the production of new collagen, but also other proteins that is going to, can be glycosaminoglycans or also hyaluronic acid itself. Also, it's important to note that we are going to have antioxidant and anti-inflammatory activity thanks to the high molecular weight HA. So that's why I was explaining at the beginning that we have good activity on cuprosis patients. Let's want to focus now on the clinical trial. We made a study design. It's a prospective, monocentric, open, non-comparative, and we want to assess the efficacy and the safety of Cell Booster Lift. We did it on female and male subjects, 40 subjects. They were aged between 36 and 55 years old. And we did 3 treatment sessions, and we assessed the results at 42 days and at 84 days. We put EMLA cream, topical anesthetic, and we injected 3 milliliter Cell Booster per session. We didn't inject on the forehead area, so we only inject on the medium and lower third of the face, intradermal injection with the classical papula technique. And we made the same injection technique and depth for every patient. Which ones were the objective of this study? Was the effectiveness on the improvement of the skin quality. We wanted to evaluate it according to the global aesthetic improvement scale, the GAZE, and was evaluated by the investigator 2 and 8 weeks after the last treatment. We also evaluated this scale by the subjects 2 and 8 weeks after the treatments, and we evaluate the satisfaction of the injectors and the subjects. That is also important, how satisfied were the injector doctors and how satisfied they were the patients after the treatment. We did, to illustrate the effect on the skin, we did 2D photography through the study period, and we also evaluate the safety with injection size reaction and adverse event collection. Let's gonna take a look at the results at day 42. The patient inclusion, we were 41. The average age was 47 and a half. We included people from 36 to 55. And all subjects, we requested a specific iteration value at the baseline that needed to be minus of 60 AU. So why we wanted that? Because patients that they got the skin too oily or too much hydration into the skin was difficult to validate the change. We did 3 injection sessions bi-weekly. And with the we checked some skin parameters. That was the hydration, the density, the microcirculation, the color, and the wrinkles parameters. So that was our first objective, was the hydration that we can see in the change from baseline at the epidermis. So we are looking to have 2 points, at least 2 points more hydration at day 42. And then we did all the other secondary functional measurements: hydration, skin parameters, color, microcirculation, and density. And we also did these subjective measurements: the aesthetic effect, the GAZE score, and the degree of satisfaction. The safety was assessed during the whole experiment. We did full analysis set, so any subject included in the study with at least a post-basal value, and a PP and safety population. So that was the statistical analysis and proportions. The technique was intradermal injection. Here we can see a little bit. The technique procedure was done with 4mm needle intradermally with an angle of around 30 degrees. In some areas that was needed a little bit more cell booster, we put a micropapula, and on the rest of the face, we proceeded with papula technique. All the patients were anesthetized before treatment with EMLA cream. So you can see here the papula technique, and we did the medium and lower third of the face for this study. What we found? Well, on the corneometer that we are checking the moisture changes, we found a significant improvement on the skin hydration. That's the primary endpoint. And this is very important because that means that we succeed to prove that cell booster lift is capable to improve the hydration at D42 compared to the baseline with 12.4% more. The improvement of the skin hydration was statistically superior from 2 at day 42, so which indicates the efficacy of the treatment. The viscoelasticity is also measured with 𝗃𝗏𝗏𝗏𝗏, and we see significant improvement in the skin viscoelasticity 2 weeks after the last injections. So we have plus 12.5% on improvement of skin viscoelasticity. This is also a statistically significant, so that also we can prove that we got, with this objective measurement, better viscoelasticity of the skin. The density of the skin was done with dermascan machine, and we see a higher increase, plus 29.2% on skin density. This is made by echography, so we have echogenic tissue, and we also have a significant, statistically significant increase 2 weeks after the last injection. And what that means for our skin is we're going to have more rejuvenated cells, such as the fibroblasts, and we are stimulating the skin from the inside to produce more collagen, elastin, and hyaluronic acid. With a laser Doppler, we check the microcirculation. We have a huge improvement on the microcirculation, plus 37%. So we are significant statistically. So more than 15 units. And that means that we're going to have a better blood flow, so more oxygen and energy for the tissue. So we're going to have more, better nutrition, better oxygenation of the tissue, so that will also have an effective activity on the cells that we have in the skin. Then on the aesthetic rating, because sometimes you have all of these that you can measure with objective specific technologies. But what is important is if we can see an aesthetic result, and that was measured by the investigators and the subjects, and we got much improved and improved, and more than 80% height or very high satisfactions for both, for the investigators and the subjects. So we have very high satisfaction and statistically significant responder rate as rated by the investigator, but also as the subjects. We can compare with other studies, and the response with other products on the satisfaction rate is not as high as we achieved with this study with CELLBOOSTER LIFT. So the very high satisfaction rates among included patients, we see 90% high or very high satisfaction with, as they consider that the treatment was good, that they obtained results, they feel a more hydrated and firmer skin, and more than 60%, so more than half, they were satisfied in all the parameters. What we ask is, they are made several questions to assess that, and we could rate it like not at all, a little, a lot, or totally. So the intervention was good for me. 90% was positive on that. Am I satisfied with the obtained results? Also 90%. Do I achieved rejuvenated face? 75%. Hydration skin, 90%. A skin with less redness, 70%. So that gives us an idea of the anti-inflammatory activity that this product can have. They more than 60% of the patients, they consider that the skin look less pigmented. Remember that we have vitamin C into the formulation and as anti-tyrosinase effect, so anti-pigment effect. So we also see the activity of this active ingredient into the formulation. More than 80%, they consider more beautiful skin. So it's the way they feel. That's also important. 90%, they consider that they have a firmer skin. And more than 90%, they consider that they achieve natural results. More than 80%, 85%, they will recommend this treatment to a friend or a family. Let's go and see some pictures of the results. This is before and 2 weeks after last treatment. We can see very clear that we have better turgor, we have hydrated and glowing skin, and we also see a reduction on the hyperpigmentation. We see improvement of the skin quality. That's what we wanted to achieve with that patient. Here we have a little bit more pigmented skin before the treatment, and we see a reduction in pigmentation, reduction and redness, and an improvement on the structure and the glow of the skin. In this case, on a male patient, we see an improvement in pigmentation, a reduction also in redness, and better structure and better glow of the skin. So you have more luminosity and more healthy skin. Here, another patient. Also, we see the tone unification that we have after the treatment, reduction in the redness, and an improvement in the structure and the glow of the skin. So we have 100% high or very high satisfaction during the injection sessions. This is also important. So they are not difficult to inject this product. It's easy to place the product on the right layer, and the vial is very easy to manipulate. And we are also able to see very clear if you have any turbidity into the vial. Remember that this product has hyaluronic acid and active ingredients, so maybe for the transport could have any crack or any opening. This will get turbulent, so we never need to inject it. So once we open, we need to inject this product because it doesn't have any conservation ingredient. So it's pure hyaluronic acid with the active ingredients. So that's very good from our side as injectors. We got some little injection site reactions. Is the one we expect when we're using a class 3 medical device. So we can have a little bit of bruising or a little bit of swelling on the injection area, but was solved quickly 1 or 2 days after the treatment, and it was some patient that got a little bruise that lasted a little bit longer, but was also resolved spontaneously without the necessity of any further treatment. So in conclusion, we're going to have plus 12.5% better viscoelasticity, plus 12.4% better skin hydration, 29.2% skin density, high or very high injector satisfaction, and more than 90% high or very high patient satisfaction. Besides that, and that I think is the most interesting of this product, is the improvement more than 37% on skin microcirculation. So we are really gonna stimulate the skin through this better oxygenation of the skin thanks to the microcirculation. So that's why we're going to have these longer lasting results. It's a well-tolerated treatment, as you can see, with the low index of injection site reactions. Now we saw the study. Let's see how we can combine it together with other treatments, because this has a lot of demand and will be the best for your patients. We can combine them differently: lift, glow, hair, and shape, depending on the indication. And it's important also that we understand why we have these cumulative effects with Cell Booster. We can see that once after we completed the protocol, we are going to have a healthier, more hydrated, better microcirculation in the skin. And then we can do the maintenance because it's like when we go to the gym. If we go to the gym for 2 months and then we stop, we're going to lose what we improve. But if we do continue with some training, if we continue with some injections with Cell Booster, we are going to be always on this green area. That means healthy and good quality skin. This needs to be adapted, of course, to every patient, and can also be combined together with other fillers, botulinum toxin, or energy-based device for the best of your patients. I want to present some results of my colleagues, in the case from Dr. 𝗃𝗓𝗏𝗏 𝗏𝗏𝗏𝗏 from Switzerland. He did a protocol of injection with Cell Booster Glow combination and Cell Booster Lift. Cell Booster Glow on the pigmented areas and Cell Booster Lift on the rest of the face, and we see the benefits on the skin tone, reduction of wrinkles and reduction on the hyperpigmentation. Very nice results, better skin quality here on the lateral, and we can see on the other side. So we see that it's a very, very effective treatment. He did 3 sessions, that is the protocol, with 15 days, 2 weeks between each session, and we can see a fantastic result. Other combinations possible could be, for example, in the same session, Cell Booster Shape and Cell Booster Lift is one of my favorites. I inject intradermally Cell Booster Lift on the face. I'm using the 𝗵𝗴𝗵 technique, the same that we use for the study. And then on the trigonum submandibulare, I inject Cell Booster Shape subcutaneously. I pinch the skin 1 centimeter and I inject 0.1 milliliters per point. Cell Booster Shape will also be used for periocular edema in the same session. I generally use 1 vial of Cell Booster Shape and 1 vial of Cell Booster Lift biweekly, as is stated on the protocol, with very nice results. Can we combine it with other products? Well, we can combine it with our skin booster Apriline Hydro. We are going to use Cell Booster Glow with Napash technique and Apriline Hydro with 𝗵𝗴𝗵 technique. This is a case of Dr. Hervé Pavé from France, and here we can see a combination of 3 different products. He combined Cell Booster Shape, Cell Booster Lift, and he wanted to give a little bit of volume, and he used Apriline Forte to improve the volume of the face. So here we have a very good combination. We are not only improving the volume of the face with Apriline product, so we are also improving the quality of the skin with the perfect combination of Cell Booster Shape and Cell Booster Lift. Dr. Pavé used 1 vial of Shape and 2 vials of Cell Booster Lift, and we can see a very good result, and on the skin quality, but also on the volumization, achieving a very natural and beautiful result. Here we have the other side of the face. A combination with energy-based device, in that case again from Dr. 𝗃𝗓𝗏𝗏𝗏𝗏, we can do it on the same session. we do the energy-based device, in this case is the 𝗵𝗴𝗵, first, and then we can wait a cooling phase. We can wait 10-15 minutes, and then we can apply directly the cell booster product because it's gonna improve the microcirculation, so we're gonna have a faster recovery, for example, for the double chin, or also for the belly area or the love handles. We could use any of these combinations. But remember, always first the energy-based device or the laser. I think we got a very nice overview about the CHAC technology, about cell booster lift study, and how to combine it with other treatments. So I don't want to take more time from you. So we're going to go to the questions. Please remember, you can make it on question and answers. And I'm going to look at it. They say, besides the concentration of hyaluronic acid and a little bit of the formulation in vitamins and amino acids, what is the difference between red density 1 and cell booster lift? What will be indications for both of those? Thanks. And of course, besides the CHAC technology, well, red density is not made with the CHAC technology. Of course not, but red density is another kind of product. It's not stabilized. So this product will not stay. CHAC technology stays for 2 weeks into the tissue. So we're going to have this liberation of hyaluronic acid and vitamins, and we're going to have an improvement of the we're going to have an improvement and a stimulation of the cells. The other ones that they are not stabilized, that they are not cross-linked, they will disappear between 24-48 hours. So you will need much more injections, and the results will be shorter in appearance. We can inject cell booster to the forehead area. Yes, definitely we can inject cell booster in the forehead area, and I do it a lot. But because of the machines we need for measuring the results, they have a specific area that can be applied. In this study, we didn't use it on the forehead area, but you could inject it on the face, in the neck, in the hands, in the forehead, everywhere. I have another question, very interesting. Can we inject 2 types, for example, lift and shape, to the same area and the same session? Yes, definitely. Definitely you can do it. I show you a combination of 2 different areas, but you could inject cell booster lift intradermally and cell booster shape subcutaneously because our target is different. Cell booster shape is to reduce water retention, to stimulate lymphatic drainage, and to reduce localized fat. Cell booster lift is an indication to improve the skin structure, hydration, and a reduce of pigmentation, improving the tone. So you could inject it on the same area. I will not recommend any way on an area like the face to put more than 3 vials in one session. Generally, counting also the neck, the double chin, this area, 2 vials, it's enough, because otherwise we're going to give a little bit too much edema because of the injections and the quantity of hyaluronic acid. Then another person, can shake help for under eye bags? In which cases it will really help? Well, yes, definitely can help. It will help when we have excess of edema, and when we have localized fat. Sometimes this little prolapse of the of the fat pad can get improved with cell booster shape, but will not help if we have an excess of skin. If we have an excess of skin, or we have a big resorption of the bone. This is a different product that we need to use. For example, to improve the bone resorption, we could use 𝗵𝗚𝗏𝗏 Forte. And if we have an excess of skin, we could use surgery or an energy-based device. But the target is very important. The indication of the product is very important. So don't use this product for volumizing, because it's not a volumizer. Then 𝗏𝗏𝗏𝗏 is asking me, for atrophic acne scarring patient, how to inject lift? What technique? Well, on atrophic scars, we inject around the scar and into the scar. You can read my article, for example, poster I presented for striae, that I inject around the striae and into the striae, so to try to closer the area and improve that. We have an improvement of all the skin, so that's why we're going to have this this beneficial effect. Do you use Cell Booster Glow on the darkened underarm area? Yes, you can use it effectively there. And also, if you are using any other treatment, like would be a peeling or a laser, to prevent to get this pigmentation again, because Cell Booster Glow not only has vitamin C, but also glutathione into the formulation is two of the key elements of Cell Booster Glow. So we are going to have inhibition of the tyrosine, so we're going to have a reduction on the production of melanin. Another question, can we use Cell Booster Lift together with botulinum toxin? Yes, definitely, because, and I do it in the same session, because we are going to inject the botulinum toxin intramuscularly, and we're going to inject Cell Booster Lift intradermally. So we are not working on the same plane. You're not going to have any complication. I do it all the time in my practice without any side effect. Which 𝗏𝗏𝗏𝗏 is asking me, which product is recommended for hair treatment? Well, it's Cell Booster Hair. Cell Booster Hair, and we're going to inject it intradermally on the scalp area. You can use 1 vial per session bi-weekly, and we're going to have very nice and fast results. Okay, so I don't know if you have any more questions. But if you want to learn a little bit more, or you have more interest, I can recommend you to read my latest publication on Prime, that we unveil the capacity of the patented CHAC technology. And regarding this question about pigmentation that you made us, we also publish on the Polymers magazine. It's a Q1, very indexed on PubMed. So if you put my name there, you're going to find it the first one, because the last one we published with an important reduction of the pigmentation. Otherwise, you can find it also on the CELL website, where you have all the publications about Cell Booster and 𝗵𝗚𝗏𝗏𝗏. Remember, you can always follow us on Instagram at CELLPro, Facebook at CELL Global, LinkedIn and YouTube to know all the latest protocols. And was a pleasure for me to be with you today. If you have any question, if you want to review this webinar, or you couldn't, you know a friend that couldn't attend, this webinar has been recorded. Let's gonna look if it was any last question. And from Kate Janska, which product will be the best for reducing redness? Well, CELLBOOSTER LIFT will be the best product for this redness indication, as we saw on the pictures results of today. Thank you very much for your time. It was a pleasure to be here today, and hope to see you soon around the globe, or maybe in another webinar. Have a nice afternoon, and see you next time. Bye-bye.